I was looking at my schedule and I saw the last patient of the day was a teenager named Anthony, and he and I had met before. He was a really friendly, outgoing kid, so I thought, oh great, it'll be nice to see him. So we got to him, the last patient of the day, and I picked up his chart, and I noticed that his chief complaint on the chart was cold symptoms, and I thought, great, because that meant it could be a really straightforward, easy visit. I could get it done, get going on all my catch-up work, and then hit the road down to New Jersey before the traffic hit. So basically I went into the room and I just kind of went through a very brief history and physical, very focused, directed questions, did his physical. Everything seemed to be fine, which was great. And so I gave him some, brief advice and some reassurance, and basically had my hand on the doorknob and turned around to him, was about to say goodbye, and I said, I hope you have a really great Thanksgiving. And he smiled at me with a very earnest smile, and he said, thanks, Dr. O. It was looking like we weren't going to have a Thanksgiving, but my mom's food stamps checks came in a little bit early, so we are going to have a Thanksgiving this year. And I froze. My hand just kind of froze there on the doorknob because, I realized that I had almost missed it. I had almost missed this major health issue that would have a whole lot more impact on him and his health and well-being than the cold symptoms that he came in for. So I took my hand off the doorknob and I sat down, and honestly, it really only took a few more minutes for me to just sit and talk with him and find out really what was going on, what was the status of living at home. And we were able to arrange, fortunately because we have the resources in the clinic, able to arrange an emergency referral to the food bank for that day, and then a time for him and his family to come and sit with our social worker next week to talk about income supports and that sort of thing. But I still remember that, that happened many years ago, but it's still very fresh in my mind because it just, I think it was kind of a wake-up call sort of reminder. That experience, beyond the individual interaction that I had with Anthony, I think it also just reminded me of all the other socioeconomic issues that affect a patient and a family. So I could have an interaction with Anthony as an individual or even his family in the office. But it also reminds me that, perhaps we actually have an obligation as health care providers to think about the other things that we can do for the community. It helps me think beyond just the patient and the family to even think about, well, what are the other resources in the community that we as a healthcare provider can connect with and develop stronger relationships with, so that we can provide help to our families on a much broader scale. As a perfect example, we've got resources now in our clinic where we have basically college students coming into the clinic who are our point people now. Basically, if clinical staff identifies a need within just an interaction with a family, a need around housing, utilities, food, job training, childcare, we actually have college volunteers that help staff during the clinic. So we identify the need, we match the families up with the college volunteers who basically can search databases, help patients come in. It's nice as a healthcare provider to be able to offer that resource to make it just easier for families to access, because a lot of these resources out there, the systems are not very easy to navigate. And so if we can actually make that easier for our families, I think it empowers the families, it helps them get the resources they need, and I think overall makes their quality of life and their well-being much better.